Thank you, Cheryl, and hello, everyone. Good afternoon. My name is Brandon Stinchfield, and I'm the Director of Institutional Partnerships at SAGE. I'd like to welcome all of you to Finding an LGBTQ+ Inclusive Long-Term Care Community, hosted by AARP, the Human Rights Campaign Foundation, and SAGE. We are very grateful for the support provided by AARP as we work to increase LGBTQ+ inclusive long-term care communities. A few programming notes before we get started. This webinar is being recorded today. As Cheryl mentioned, that is for viewing by those who cannot attend. Live closed captioning is available by clicking on the closed caption CC button at the bottom of your screen. And we will have time at the end of the presentation for questions and ask that you use the Q&A option for submitting your questions. Now, it is my pleasure to introduce our panelists. First is John Paul C. Hayworth. John Paul is the LGBTQ+ Audience Strategy Director in the Office of Diversity, Equity, and Inclusion at AARP. In this role, he is responsible for expanding the understanding of the LGBTQ+ community's needs within AARP and broadening the knowledge of AARP resources within the LGBTQ+ community. He joined AARP in June 2022 after more than 15 years working for the government of the District of Columbia, and including 7 years as the Executive Director of the DC State Board of Education. Welcome, John Paul. Next is Dan Stewart. Dan is the Associate Director of the Aging Equality Project at the Human Rights Campaign Foundation. In his work, Dan co-leads the Long-Term Care Equality Index. A Chicano transgender man and gerontologist, Dan has over 10 years of experience in the aging and LGBTQ+ advocacy fields. Welcome to Dan. And last but not least is my colleague, Cheryl Wayland. Cheryl is the Director of Special Initiatives at SAGE, directing the National Resource Center on LGBTQ+ Aging. She's also supporting a number of other initiatives, such as the Long-Term Care Equality Index, SAGE Care Training and Credentialing Program, and the Diverse Elders Coalition. Cheryl has been working with SAGE at the local and national level since 2008 and has over 25 years of experience in education, disability, aging, and LGBTQ+ advocacy. Before I turn the show over to John Paul, I did want to quickly mention that in addition to the closed captioning, we have an ASL interpreter available as well. Thank you again, all of you, for coming, and I will now turn it over to John Paul.
Thank you so much, Brandon. And thank you for being here, and for SAGE and HRC for participating in the creation of the LEI, which we'll be talking about very shortly, but also for all of your hard work over the years for the LGBTQ 50+ community. It's really inspiring, and it's one of the things that brought me to AARP, is to help do some of this work on behalf of the largest member organization in the country. AARP has, for over 60-something years, been one of the major players in working on behalf of all of our 50+ population. We do our best to be the wise friend and fierce defender of everyone, who does its best to empower every single American to really choose how they live as they age. And we have a number of resources in caregiving on our website at aarp.org/caregiving, as well as a new website that just launched specifically focused on long-term care, which is at aarp.org/long-term-care. Make it easy for everybody to remember. But our partnerships with SAGE and HRC are incredibly important to us here at AARP because of the amazing work that you guys do. And so I'm very excited to be here as a member of this panel, but also to recognize the importance of this partnership that we are doing together to make sure that the 50+ LGBTQ community continues to grow and thrive, and is able, like I said earlier, to age as they want to. Cheryl, I'm going to go ahead and turn it back over to you now to talk a little bit about the needs of the 50+ LGBTQ community.
Thank you so much, John Paul. So I just wanted to start really by sharing a little bit more about SAGE. SAGE is America's oldest and largest nonprofit dedicated to improving the lives of lesbian, gay, bisexual, transgender, and queer expansive communities. We're excited to be partnering with HRC Foundation on the Long-Term Care Equality Index, or LEI, and very grateful to the support of AARP. So thank you again, John Paul, for joining us today. LGBTQ older people reside in communities large and small across the country. The LGBTQ older adult population continues to grow, just as the population of baby boomers. And we estimate that by 2030, there will be approximately 7 million LGBTQ people over the age of 50. And many of us will turn to long-term care communities for support as we age. As older adults, we are diverse, with estimates indicating that nearly 20% of LGBTQ people are people of color. So it's really important that we continue to center intersectionality in our work. Research by AARP in 2018 found that nearly 60% of LGBTQ people surveyed are concerned about how they will be treated should they need to go into a long-term care community. And additionally, 88% want providers who are LGBTQ welcoming and sensitive. I know for me, this is very important. For me, my friends, my network of LGBTQ community members across the country. And at SAGE's National Resource Center on LGBTQ plus aging, I receive requests almost weekly from people like many of you who are here on this webinar today, seeking information on LGBTQ plus welcoming retirement, assisted living, and skilled nursing communities. And while we believe that most long-term care communities want to support LGBTQ people, the fact remains that it's up to us to inform ourselves, our friends, and the broader community on not only how to identify LGBTQ welcoming long-term care, but where they are, where those communities are across the country. And this is why this webinar, the toolkit on finding an inclusive long-term care community, and our work through the LEI is so important. And as I turn this over to Dan, I will also share a link to our report on finding LGBTQ plus inclusive long-term care communities. Dan, do you want to share a bit more about the LEI?
Thanks, Cheryl. The Long-Term Care Quality Index is the national LGBTQ benchmarking tool that evaluates residential long-term care and senior housing communities, policies and practices related to equity and inclusion of their LGBTQ plus residents, visitors, and employees. Modeled after the HRC Foundation 15-year Healthcare Quality Index tool that works with over 2,200 healthcare facilities nationwide, the LEI strives to create sustainable policy and culture change in the senior housing industry. With free resources, technical assistance, and a biennial survey, the LEI helps senior housing communities implement, strengthen, and innovate their LGBTQ plus inclusion efforts. Currently, in its first survey cycle, the Long-Term Care Quality Index, also known as the LEI 2023 survey, closes at the end of this month. Participating communities offer nursing care, assisted living, independent living, hospice, and affordable senior housing. As Cheryl stated, SAGE and HRC believe that most providers want to provide care, but may be missing gaps in how to do that. SAGE and HRC Foundation will release the findings of our survey in the LEI 23 report in May 2023. The report will list communities actively working on the inclusion of LGBTQ plus residents, designate leaders in the fields, and be accompanied by an online searchable database. SAGE and HRC Foundation believe that the LEI was developed to meet a deep and urgent need on the part of LGBTQ plus Americans, the need for equitable, knowledgeable, sensitive, and welcoming care free from discrimination. We believe that most long-term care communities do not want LGBTQ older people to face discrimination or have to worry about the care they will receive. But these communities may be unsure how to protect their LGBTQ plus residents, provide them with optimal care, a warm welcome to allay their concerns. The LEI encourages and helps long-term care communities to adopt policies and best practices that provide culturally competent and responsive care. You can learn more at our website, www.thelei.org. On behalf of the HRC Foundation and SAGE, we look forward to sharing our tips and guidance today and how to find a welcoming community. I'd now like to turn the show back over to John Paul to lead us through a few discussion questions.
Thanks so muyou Dan and Cheryl. I really appreciate all that information. And I know our attendees are also very excited about getting this information that you guys have put together. I want to note for the folks who haven't yet gotten a chance to look at the chat, Cheryl's doing an amazing job of putting some of the links and information that we're going to be talking about into the chat, so you'll have access to those once the webinar is over. You'll have access to those links that we've been chatting about so far. So let's get down into it. Cheryl, can you talk to us a little bit more about what type of policies or things that we should be looking for as an indication that a long-term care community is welcoming to the LGBTQ community?
Thank you so much, John Paul. I think that's a really important question, and one that we often get asked here at SAGE and also through the HRC Foundation. And we all deserve to feel safe and have our needs met when seeking care. And especially when, thinking about leaving our own home or apartment where we've lived most of our lives and going to a new place that we're now going to call home. So it's really important that we know that long-term care communities are dedicated to LGBTQ+ inclusivity. And this starts and must be rooted in policies and practices. Policies and practices that are inclusive of LGBTQ+ older adults, shape an organization's culture, and signals what we can expect when seeking services as potential residents, as family members and caregivers of LGBTQ+ older adults. Really starting to look at these policies are critical. And when looking for a long-term care community, we suggest as a starting point, looking at their resident and employee non-discrimination policy and statements, and specifically looking to see if they are inclusive of sexual orientation, gender identity, and expression. So where do we find these policies? We can find them on their website, on marketing materials and brochures, on applications to become a resident. These are all places where we should expect to see that non-discrimination policy for residents and also visitors. But what if it's not there? What do we do? Ask to see their non-discrimination policy. And if it's not inclusive of sexual orientation, share with them how important this is. Invite them to look at information provided through the Long-Term Care Equality Index and to seek out recommendations from SAGE and HRC on how they can become more welcoming and inclusive, starting with these very critical non-discrimination policies. Another area that we look at is staff training. Are they providing ongoing in-services and staff on diversity, equity, and inclusion? And does this work include the concerns of LGBTQ people, residents, visitors, and employees? This is really important that this information is being provided. And again, if you don't see these policies, encourage them to reach out to groups like SAGE and HRC for guidance and how they can implement these policies. As LGBTQ people, we've really become accustomed to looking for these policies. And if we don't see them, then this can signal to us that, maybe we aren't welcomed. And so it's really important that this is a part of that foundation.
That's great. And thanks, Cheryl, for making sure that we have all that information. I think you're absolutely right. I mean, some of it is asking the questions. And I really want to note that HRC's and SAGE's work in compiling those types of questions that you need to be able to ask. I think there's a lot of really interesting conversations that can be had in these types of areas across the country, whether that's in an urban environment or in some of our rural communities. You might be surprised at some of the responses on these questions. So I think that's really important. Dan, in the same sort of mindset, I mean, I think we've all heard some of those stories about folks who have been separated in the LGBTQ community from their partners, or making, having the ability for their family and friends to visit them and visit folks in these long-term care facilities. Are there any specific protections or rights, either at state or federal level, that we should be aware of as we're talking about these?
You know, moving into a long-term care community can be scary and isolating for anyone. So having the support of family and friends who visit is vital. So let's start with visitation there. An equal visitation policy that ensures all residents can choose their visitors is critical for all residents, regardless of sexual orientation and gender identity. In terms of rights, the federal government does require that all long-term care communities receiving Medicaid or Medicare funding must grant residents their rights and protections. These rights, also known as residents' rights, cover a wide variety of areas of life. Many states also include residents' rights in state laws or regulations. And within the residents' rights is the right to spend time with visitors. So expanding on that right to spend time with visitors, this includes that your visitors can visit you at any time, 24 hours a day, as long as the visit does not interfere with the provision of care and privacy rights of other residents. This includes the right to have visitors of the resident's choice. So that includes same-sex spouses, partners, our families of choice, our families of origin. So not just being able to see them, but also being able to have them visit at any time and do so privately. And lastly, this also includes the resident being able to receive visitors that help them with health, social, legal, or other services at any time. So these rights, combined with an inclusive resident non-discrimination policy, including sexual orientation and gender identity, as Cheryl was stating, really provide strong protections for LGBTQ plus older people living in skilled nursing communities, or nursing homes, what some folks may know them as. However, these guidelines only protect that skilled nursing community residents. So those that don't live in nursing homes or facilities that are receiving Medicaid or Medicare funding may have to take that additional step to have a visitation policy. The Long-Term Care Quality Index advocates so that all LGBTQ plus older adults are receiving the same level of care, regardless of the type of housing. So what we're asking and seeing is housing communities explicitly guaranteeing in their visitation policy that folks, again, can receive their visitor of their choice. This is a critical piece in ensuring that folks, again, can have all people, whether they are family members, families of origin, so that we can have that support that folks need, especially at that time. Folks can find visitation policies commonly on a website. You can search on these websites to see if there's a visitation policy. But if you're not able to find it, you are very much in your right to ask for marketing material, see if there are things posted in the building, or ask the community representative for a copy of that policy. Now, visitation, we kind of have some firm rights in terms of federal protections, state protections, residents' rights. But for those who may be living in assisted living or independent living, it is an added step that these properties are taking often. So it is, again, within your right to ask and be affirmed that as a person living in a community, you have the right to have your visitor of choice, as well as deny a visitor as well. Now, you also mentioned about rooming and being able to share rooms with your same-sex partner or spouse. And, you know, if you've been privy to the news in recent years, we have seen federal lawsuits against long-term care communities that have denied same-sex couples the right to room together. And in addition, and more recently, we've seen more and more cases of communities denying admission of transgender older people. So an inclusive rooming policy will make sure that LGBTQ people will receive equal treatment regardless of sexual orientation and gender identity. So while rooming policies aren't necessarily generally made available online for the public to view, again, as a consumer, as someone who's seeking where you may live, you have the right to ask regarding this policy when speaking to a representative from a housing community. By asking directly of, can I share an apartment, room, bed with my same-sex partner, or asking directly if I will be able to be assigned to a room that aligns with my gender identity. It is important to note that when speaking to representatives, they may state yes, but the policy may not be there. So again, ensuring that we are actually having these answers written down in policies to ensure that folks, again, are affirmed and get to live with their spouse and partner. Unfortunately, many folks don't live in states with protections at the state level for sexual orientation and gender identity, but there are some municipalities that do, as well as about 25 states that do have protections. So, you know, I think in regards to protections, they are there. But again, as Cheryl was stating earlier, often as LGBTQ plus people, we do need to educate ourselves in order to advocate for ourselves.
Thank you. You know, it remains very frustrating, right? That we have to decide where we live based on whether or not we have the same protections as everybody else. You know, we are doing everything we can as organizations, but also as Americans, I think, to make sure that those protections continue to expand wherever you are. Cheryl, let's talk a little bit specifically about the trans community. What are the specific types of discrimination that the transgender community would face in these types of environments of long-term care?
Again, John Paul, that's a wonderful question. And, you know, personally, I've experienced long-term care communities saying they don't know how to support someone who identifies as transgender. And I've heard of communities who have turned someone away, you know, because they identify as transgender. One of the stories I heard locally in Missouri, and this was a few years ago, it was an older transgender person who had actually entered into hospice and needed to go into a long-term care community. And their children were having trouble finding a place that would, you know, serve their parent. And, you know, they had called several locations, and finally, you know, through their advocacy, through the support of other organizations, they were able to find, you know, a long-term care community that would accept their parent. So a lot of times, you know, we are seeing just flat out denial of services. And again, as Dan mentioned, you know, we've seen some recent cases, I believe one out of Colorado and the other, I think, was on the East Coast. And they were both, you know, trans older adults who had been denied care. They were able to, you know, later receive that care, but, you know, oftentimes it's at their own peril. If they're not receiving that type of support and services, you know, it can impact their health and overall well-being as they're waiting for, you know, a long-term care community. But there are a number of recommendations that we make through the long-term care through the long-term, what are we calling our project? The Long-Term Care Equality Index. Yes, too many things going on in my head today. There are a number of recommendations that we do, you know, make for long-term care communities. And one of those recommendations is, you know, to start with our intake process. Make sure that, you know, when we are interviewing folks for as potential applicants, or a resident is signing their, you know, paperwork to become a resident, that we're allowing them to say, you know, what name do you use? What pronouns do you use? And what do you want staff to use? And this may or may not match their state issued IDs or life, you know, health insurance cards. And that's okay. We need to make sure that we're honoring a person's name and pronouns, and that we communicate that to staff, and that staff are required to follow, you know, the wishes. Many of us have names and nicknames that don't match, you know, our birth certificate or our driver's license. And we honor those out of respect. And so that's, you know, one area that's very important and that we, you know, recognize and really recommend up front. We also, you know, encourage folks to look around the environment. If there are public restrooms, are there gender neutral restrooms? If not, is there signage that says, you know, we support people to use the restroom that matches your gender or your gender identity? And rooming policies. We recommend that there is a rooming policy that allows people to request the room that matches their gender identity. And, that's another policy that can really help ensure that transgender residents are supported and welcomed. And then another area that we oftentimes don't think about, but I think is also really important, that's events and activities that are hosted within our long-term care communities. Are they gender neutral? Are they inclusive of all genders? An example might be, seeing a spa day that's just for women, or a happy hour at the sports bar for the men. Those are examples of, activities and events that really don't require a gender exclusivity. And so we're really encouraging folks that they have gender neutral activities. Just host a spa day. There are many people that like to go to the spa and have a facial or a pedicure or a manicure. Happy hour at the sports bar. Make it inclusive of all residents so that they feel welcome to attend the events and activities that they enjoy. And it's oftentimes little things like that that can really be a signal of cultural awareness and inclusivity. And Dan, I'd welcome any additional thoughts that you may have.
There's a lot more movement, just to give some hope in the matter. There's a lot more movement within the nursing home industry, skilled nursing home communities to want to learn more. They recognize that they're already serving trans clients, and so often they're reaching out to really solidify that welcome space. So as Cheryl mentioned, really having inclusive gender neutral language, having access to policies that state room that affirms someone's identity. But in addition to that, also the inclusion of policies that ensure individuals will continue their medical care, such as hormone replacement therapy, that individuals will be recognized as who they are, regardless of legal status of their gender or legal name of that sort. So really what we're seeing here is the desire and growth of providing an inclusive environment. And part of that is helping educate people on what that means. Thanks, Cheryl.
Yeah, I think that's absolutely right. I mean, the fact is that it is often a lack of knowledge or understanding that can really lead to some pretty significant challenges. I'll note anecdotally that the AARP Foundation, which is one of our branches and one of our affiliates, has a pretty strong litigation team, I'm going to say. And one of the things that we recently did was, frankly, sue the heck out of a nursing home that was not appropriately addressing one of their patients' pronouns. And we were very successful in that suit because it's pretty easy to tell whether or not you're actually providing the particular the pronouns appropriately or not. But one of the things that we challenged them on was making sure that all of their staff have access to those DEI type trainings and understanding how important it is to the person when we're talking about pronouns or something seemingly simple in terms of being able to have these types of conversations. So on that same sort of note, can we talk a little bit about home and community-based care and how that brings into to the index, and how do we think about bringing home and community care into some of these conversations about long-term care? Dan, I'll throw it to you for this one.
Most definitely. I think in terms of where people will be receiving their services, it is going to be a heavy mix of home and community-based services. In terms of really capacity, unfortunately, being a small team, we really do center in on residential long-term care and residential senior housing. However, there are a lot of basic principles and best practices that can be found on our website, thelei.org, that then can be applied on various levels to home-based and community services. There's examples in terms of what inclusive forms look like regarding some of these policies that we're talking about related to trans inclusion and gender affirming policies. Even having procedures in terms of using using a participant's name can be critical. So just because a provider or aging service provider isn't providing a home environment for someone there are plenty of applicable policies that affirm people's identities, whether they are going to a senior center or they're moving into assisted living. Cheryl, do you have anything else to add to that?
Yeah, I was going to just add that, a lot of the policies and practices that we're talking about here today definitely, relate back to that home care provider as well that may be coming into your home to provide these types of services. So again, seek out, do they have that non-discrimination policy and is it inclusive? There's also through SAGE, we have our SAGE Care training and credentialing program, and they have a number of organizations that have received training, including many home care companies. So you can, go to their website and see, who's been trained in your local community. And also, as Dan said, just a number of best practices that we have available through the National Resource Center on LGBTQ plus aging. We have a number of best practices that are available. And we also have some resource guides on, how do you evaluate a service provider? And I think those are all, really important things and tools that we can keep in our back pocket to help us evaluate the groups that we're seeking services from.
That's great. Thank you so much, both of you. I also want to note too that from AARP's point of view, we have state teams across the country, and all of our state teams have access to these types of resources, especially for the home and community-based services, but also for long-term care. That would also be a great resource for folks to be able to reach out to your state teams who are deeply involved in those communities, and we can help connect you with resources as well from SAGE, HRC, and through our AARP groups as well. So Dan, one of the things we hear a lot about, right, is folks sort of painting rainbows on things and pretending that they actually are inclusive, and showing up at Pride and handing out some candy and thinking that is being as inclusive as what we need them to be, especially in the 50+ community. Can you tell me a little bit about how we should gauge the quality of care that we're talking about in some of these long-term care communities, and how does that relate to the LGBTQ plus community specifically?
Thanks, John Paul. I think you bring up a very key point in that we may see a visual representation, but where does that align with the policies? But at the same time, if you have the policies, there are other concerns in terms of how is that actually played out into the community. So I do have some search tips and things to consider when determining if a long-term care community you're looking at has an inclusive culture for LGBTQ plus people. So first and foremost, your own and your biggest resource really is your own local network and community. What do your friends or the local LGBTQ plus organizations have to say? Word of mouth is the biggest referral source for long-term care communities. So we highly recommend asking your friends or local LGBTQ plus organizations if they have any recommendations or recommendations of where you shouldn't go. This is a way to really kind of get an insider view of what is actually happening in some of these communities rather than going blindly. I do recommend that if you're not sure how to connect with your local LGBTQ plus community center, for example, you can find information at lgbtcenters.org. In addition to asking your network for recommendations, as Cheryl just mentioned, you can also search for SAGE Care certified aging service organizations and housing providers. You can find that, and I'm sure Cheryl will drop it in the chat, but it's right there, sageusa.care. Here you can view and search by state or type of care and find communities as well as organizations that have invested in specifically in LGBTQ plus training and credentialing. And as a reminder, in May 2023, we will be releasing the Long-Term Care Equality Index database and report. It'll show communities that have taken initiatives as well as those that have some of these policies that we're talking about here today. So really, relying on word of mouth, hearing what the stories are, getting a better insight, then really it is highly recommended that if you're finding a place, let's try to find 2 or 3 if possible, and call or email those communities. There are typically people designated at these communities that are there to answer your questions, whether that's their marketing person, their resident directors, or their admission staff. And there, it really is an opportunity to be honest and ask about their LGBTQ plus inclusion initiatives. And so some of those questions can look like, do you have LGBTQ plus people living here or couples living in this community? If not, have they in the past? A key sign that we recognize in the LEI is the importance of employees also feeling comfortable being out. So seeing, are there any openly LGBTQ plus staff? You know, if we are seeing that, that is an indicator if the staff is reflecting the residents in the community. As Cheryl was mentioning earlier, and what is a very critical thing is people being trained. And not just trained on LGBTQ plus issues as a whole, but really at the intersection of what it means to be LGBTQ and be 50 plus, 65 plus. The good news is for those that are located in states like California, New Jersey, Massachusetts, or the District of Columbia, there's actual state mandates that make sure that these aging service providers undergo some sort of annual training. And in addition to also kind of gauging where this community is at in terms of their engagement with LGBTQ initiatives, is asking if they participate in SAGE Care or the Long-Term Care Equality Index. You know, we as LGBTQ plus people often have to take the onus in terms of educating ourselves, preparing ourselves, but always know that it is within your right to ask questions, to be critical, because again, you're looking for somewhere that you're going to feel safe and at home. So once you've asked your questions, once you've kind of checked with your local network, 3, I would highly recommend touring, going in person, and not just once, but twice or 3 times. Highly recommend going once during the week where you'll see maybe the administrators, full staff, but also on the weekend to kind of get a sense of if there's any discrepancies in quality of care. Be attentive to how the staff is greeting you or engaging with you. And not just the administrator that is happily shaking your hands, but from the front desk, staff that you may pass in the hall. Are there any on-site inclusion signs? So the rainbow flag, pronouns on people's emails that you may be engaging with, signage related to Pride event or something of that sort. And lastly, in terms of kind of understanding and being able to see the quality of care, really taking note of how staff are engaging with the residents. Are folks pretty well groomed? Are they engaged with their environment? Or are you seeing kind of people staying in their room, not really engaging while staff is somewhere else on the hall? So we do have to become an educated consumer in this. While as the LEI, as part of the LEI survey, is we ask communities about their policies and practices, and then actually ask them to submit all their policies, examples of what they're doing, and validate that. So while we can validate the inclusion of policies and practices, we can't guarantee the quality of care. Recommend that community members use other additional tools to help them decide. So their own eyes, ears, but also utilizing something that was for Medicare and Medicaid services, which is the 5-star quality rating system. So this is developed to help consumers, their families, and care partners compare nursing homes more easily and to help identify any areas where you may want to ask more questions. Specifically, this is called the Nursing Home Care Compare website. So you can search that online, CMS, the Nursing Home Care Compare website, which gives you a quality system of stars of 1 to 5. So that by looking at this website, you're able to see if a nursing home with 5 stars is considered to have much above average care compared to a nursing home with 1 star that may be below average care. And not only do you get a 1 to 5 star rating for the community as a whole, but here you'll also see things related to their health inspections. Have they had some issues in the past? See their staffing, how that is, because the reality is if there's less people on the floor, there may be less quality care. just by the nature of the system. And then also quality measures. So, having this opportunity to really engage and recognize that the communities that are welcoming or want to be welcoming to LGBTQ plus individuals, it's not enough just to raise the flag. And people need to know that, and you have the right to ask for more. And as Cheryl was stating, we do see a lot of folks, a lot of organizations that have every desire, want to, but it is a slow process. But we are, very heartened to see organizations and large national housing providers step up and sign on to participate in the LEI survey and do so for years to come.
Thank you so much. I mean, I think that's hitting it right on the nail on the head in terms of we are always going to be our own best advocates and know ourselves better than anybody else. And I think that goes back slightly to what I was mentioning at the very beginning from AARP's mission about aging and having those opportunities to age as you want to, and that can change too. All right, you may select the perfect place for you to be, whether that's at your home or a long-term care facility, and you can change your mind, and you can make those decisions throughout your life. I mean, and that's good and right to be in the place that you want to be when you need that type of care. I also want to quickly note too that a lot of states have offices of healthcare ombudsmen or nursing facility ombudsmen or organizations that are supposed to do some of this testing and checking to make sure that the care that folks are receiving is high quality wherever you are. But there's work to do. And that can change pretty quickly too, with a new administrator, a new nursing staff. And so we have to be very conscious of some of those decision-making processes and how do we rate those individual things for itself. I mean, we may go into one facility and I may decide that I want to be in a facility because they have better pie than the other person, than the one next to it. They have a pecan pie instead of having, a pumpkin pie or something like that. I got pie and Thanksgiving on my brain, folks, I apologize. And you may decide that, oh, well, this facility has a rock climbing facility, and so that's where I want to be. It really is a very personal type of decision-making process. And I think that's one of the things that all three of our organizations are really focused on making sure is available, is having the ability for each person to make those decisions, rather than us saying, oh, well, this is a good one, this is a bad one. I think it's really important. So we're coming closer to the end of our prepared types of questions, and I do want to encourage everyone to go into the Q&A and ask your questions there. We will do our best to respond to as many as we can get to in today's webinar. I do want to thank the folks who have already gone to the Q&A and added their questions either there or in the chat. We are taking notes of them, and we'll get, like I said, we will get to as many as we can, but I do want to remind people that opportunity is there for you. Cheryl, let's go back to you for a second. Can you talk a little bit more about what happens if we find the wrong place? What happens if we do experience discrimination, or if we are denied the ability to go into the place that we believe is the right one for us? Well, what do we do?
Yeah, one of the things that we're recommending up front as part of the participation in the Long-Term Care Quality Index is that communities have a written policy in place on where residents and potential residents can file a grievance. If you're experiencing discrimination, harassment, mistreatment, you should be able to file a grievance and have that grievance heard. But we oftentimes know that you may need to seek support outside of the community. And, it's also important to recognize that many of the regulations around long-term care, especially for retirement communities and assisted living, may actually vary from state to state and also our local communities. So a good place to start in finding where to file that complaint is going to be your State Department on Aging. Sometimes it's the State Department on Aging and Health. That would be one place to start. And also, if your state has a Human Rights Commission or a Human Rights Office, that's another place to reach out to see, how you can get support in filing a complaint. And we know, again, there's a lot of resources that we're sharing today. We will be following up in an email, with the contact information and resources that we're talking about. But I briefly wanted to share some other places where you may want to seek support. If you're concerned about residents' rights, especially in a nursing home, then contacting your local ombudsman office. And we provided a link just a minute ago to Consumer Voice, which is a program that lists all the ombudsman offices at the state and local area. A long-term care ombudsman is there to work with the resident and family to help you identify, what your concerns are, to help mediate the concern, and to help provide additional resources if they're needed. If your concern is related to potential elder abuse and neglect, then it's really important that that complaint is filed with Adult Protective Services in your state. And you can do that through the National Adult Protective Services Association. You can go there to find a link of resources that are available. And again, we'll be providing these links out in an additional email after the session today. I'm trying to multitask and get these to you as well as I talk. You may also want to call this program that's called the Elder Care Locator. This is a program that's administered through the Administration on Community Living at the federal level, and it's hosted by U.S. Aging, which is the network of area agencies on aging across the country. The Elder Care Locator can help you find the aging services at the local level. They can also help you identify long-term care communities that, if you're looking for services for an older adult family member, then the Elder Care Locator can help you find those services at the local level. And so that's another group that you may want to reach. That phone number is 1-800-677-1166. I'm also putting that in the chat right now. And then finally, another service that SAGE has started over the past few years is SAGE's National LGBTQ+ hotline. It's available 24/7, 365 days out of the year. And we have a call center that's staffed, and they are there to listen to your concerns and help you find resources at the local level. So, these are just some of the areas that you can reach out to seek information. And I would also say that, if you need to talk to someone about your concerns, please feel free to reach out to Dan or myself. And, we're happy to help you see what resources may be available in your community as you navigate what is obviously a very difficult situation if you are experiencing discrimination because of your sexual orientation or gender identity.
Great, thank you so much. I do, before we move on, Cheryl, if you can confirm that number for the Elder Care Locator, I think it was 1166, but I don't know if it was, I misheard, and I think it may be 1116. Or maybe if you can put the link to the website in the chat as well, I think that would be helpful.
Yeah, I will put the link in right now.
Great, thank you so much.
There it is.
I am super excited by some of the questions that I've been seeing, not only in the chat, but also in the Q&A. So please keep those coming. We will do our best to get to as many as we possibly can before we have to wrap up for today. But let's start from one from our friends in Belgium. As a complete random aside, I actually studied at the University of Maastricht, so the whole Benelux area is something that is deep in my heart, and so I'm super excited to see our friends from Belgium here. And the question is, does the SAGE network or maybe the HRC or AARP work with any NGOs in Europe? I'm happy to answer from AARP. We have a division called Policy Research and International, and we actually do have affiliates that are groups that we work with across the globe, and some of that information can also be found on our website at aarp.org. So Dan, Cheryl, do you want to jump in with information about your organization's work in Europe?
Yeah, we also have work that's happening internationally, and I don't have a fancy name for it like John Paul did, but if you would like more information, please feel free to follow up with me after the webinar, and I can get you connected with the folks that run that program at SAGE. Dan?
And then within the Human Rights Campaign Foundation, just as a quick aside, HRC Foundation is the educational arm of the largest LGBTQ plus civil rights organization in the country. Within the foundation, we have several programs. One is our global partnership programs, where we uplift a number of on-the-ground advocates and helping them build capacity and work.
Great, thank you so much. So let's talk about training really quickly. And so regarding training for staff is the question. Many groups use online modules for training new staff, but that doesn't really address the attitudes. It just provides that information. And how can we improve that? And I will be quiet this time and not answer first. But Cheryl, why don't you go first, and then we could go in reverse order.
Yeah, I think it's one thing for us to sit and watch a training, but how do we really make sure that's part of our culture? And part of that is really, I think that's one of the things that's so important about the LEI. It takes us beyond training and brings us to the policies and procedures. And so when we really start to embed policies, procedures, and practices that are inclusive of our communities, especially LGBTQ communities, people of color, that's when we start to change the culture and the attitudes. And it's also, taking responsibility at that community level. How are we ensuring that people just aren't taking part in a training, but we're actually living, what we're talking about and making this a part of our daily work. Dan, do you have thoughts?
Much to what Cheryl was saying is that we do see a lot of interest in these trainings, and a lot of interest from those that are providing direct care to administrative staff. But of course, there are some folks who aren't necessarily on board. And so what we do in terms of really supporting these organizations that are taking these initiatives is really help them put in the context as an employee following policy and the expectations of fitness to serve and provide care. So really in our work, expanding and putting LGBTQ plus inclusion within the forefront of what often senior housing is doing, which is trying to provide a person-centered approach, person-centered care. And so putting it in the context of these values that long-term care professionals are really already working in, person-centered, really person-centered and person-focused first, really kind of helps guide the conversation. I see in the question, I'm just going to tag this in, as someone was asking about if Cheryl and I are able to share this information or are sharing these informations on a local or national level. And yes, our long-term care quality index project is nationally supported and endorsed by AARP Foundation, some of the largest organizations, housing professionals, Leading Age, American Society on Aging. We are seeing a lot of movement within the field of actual interest in this. I know when I started this 10 years ago, and when Cheryl started before that, it would be a matter of calling folks and them saying, we don't have any LGBTQ elders here. To now, at least people are recognizing it, and also recognizing that a lot of staff members are LGBTQ plus or have LGBTQ plus family members. So it does seem that while there's a need to challenge attitudes, I would say overall, it is seeming to be a very positive things for these communities to participate in.
Great, thank you so much. So, sorry, I lost my train of thought there for a second, because I just saw a really good question from one of our attendees, Matt, in the Q&A about organizations. Do any of us, our organizations, attend and present about these issues in national meetings for association, for long-term care association or nursing home associations or medical associations? Are we on the docket? It's a great question. Yes, we are. We are loud, proud, and there. And we all three of our organizations do, frankly, a really strong job of making sure that we are not ever going to be forgotten in these conversations about how to increase quality care for our 50+ community. I mean, it is we are very much focused on making sure that we are in front of those who are making those decisions. Just recently, one of my amazing colleagues in our PRI team, Cassandra Catave, was at a medical association conference specifically for those who are working in the nursing sphere and making sure that they have access to these materials. You know, when you go into a health profession, you have to swear the oath, right? The oath to do no harm. And I would say that a majority of folks who are interested in the medical field now understand that this is part of that quality care, is making sure that you are recognizing the patient before anything else, and being welcoming and affirming for the patient and the family and the friends that were involved in that. So I don't mean to talk for you, Dan and Cheryl, but I do want to specifically note, I mean, one of the best things about working in this kind of sphere in with HRC and SAGE and AARP is being able to go to conferences and seeing our friends from whatever organization they are, because we are there and we are there pretty actively. So just wanted to note that really quickly for Matt. So one of the other questions that is on here is from George. If an assisted living facility has a written policy that doesn't state that there is no discrimination based on sexual orientation, should you just mark it off your choices if it's a concern? Are there, and then the second part of that question is, how do we talk about the facilities that are run or owned by religious organizations? And should we just assume that some of those are going to be non-inclusive?
Yeah, so George, I would encourage us to not automatically exclude a community if the policies aren't there. But you know, I think it's an opportunity for us to meet with those organizations and let them know that without those types of policies and procedures, they may be overlooked by many within the LGBTQ community who are seeking these types of services and supports. And you know, I also know that sometimes, you know, folks don't have the luxury of, you know, having an LGBTQ welcoming you know, service system in their community. So it's you know, really up to us to do some of this education across the country. And when it comes to religious organizations, communities with a faith-based mission, you know, we actually do have a number of faith-based communities who are very open and accepting of LGBTQ+ community members. So again, I don't think we want to overlook, you know, those places as potential, you know, services for us, but it is important to have a conversation, you know, if it is a concern, to say, you know, I'm looking for a service or a resident for an LGBTQ+ older adult, or for myself as an LGBTQ+ older adult, and I want to make sure that I'm going to be welcomed here. And you know, how can you support me in this, and how will I know? And if I have a concern, where do I go for help? So I think those are important questions to have, and also for us to recognize, you know, just how important it is. I saw another question that asked about, you know, much of the LGBTQ elder focus homes are in New York City, California, Florida. How about flyover country? I'm in Missouri. I'm part of flyover country. The LEI is actually working with communities in places like Illinois, Missouri, Ohio, Texas. So we are seeing these long-term care communities that are stepping forward and saying, we want to be inclusive of LGBTQ+ older adults. And it's really through word of mouth that we're finding these communities. So if you're in a part of the country that, you know, may not be known as an LGBTQ retirement area, but you know, you have these providers that are welcoming, you know, we want to know about that. So reach out to us and let us know. And I'll turn it over to Dan.
I just, affirm what you say. And I think it is also, as consumers, important to recognize that this is a fairly new thing for a lot of these senior housing properties and communities. Unlike our hospital systems that had a lot of direction federally, that isn't necessarily the case for assisted living, independent living. So because of that, while there is a desire and communities that are outwardly welcoming, they're still catching up of what it actually means to do that. And what we see is not necessarily such a big push for folks to care or to want to put effort into this, but really just like filling those gaps of lack of knowledge. And, I appreciate encouragement of folks to ask about these policies, to continue with those conversations, because part of what our efforts here on the screen here has been for many years is letting long-term care providers know that you are out there and that you are wanting care and that you are seeking care, but for many reasons may not, or think that there's even an option nearby. So, in terms of the work to create inclusion at communities across the US, it really takes a village in terms of, large organizations like ourselves, community members on the ground, just continuing the conversation of why this is important and that ultimately we all deserve choice and a safe place to live.
Absolutely, and I think that also goes a little bit to Fran's question from a few minutes ago about communities that are more exclusive or are marketed to the LGBTQ community. Yes, there are, right? There are ones who specifically design and focus on this community. I would note, and at least from the AARP side, and I know as well from Sage and HRC, we're very much working on every place being open, affirming, and safe for this community, right? We understand that there are certainly those individual spaces that are focused on that, which are doing a great job, and we are very, much happy that there are these opportunities, especially in the larger cities, but also hopefully in some of what was it, flyover country. I'll note in the chat, a lot of folks are saying exactly where they're from. I'm from Kansas as well, so I am flyover country as well. Although I am currently based in DC, it is definitely from my heart. But those types of things are what we're talking about, and why the index is so important for us to be talking about today is making sure that we don't have to be pushed into particular cities or particular places, but that we can age in the places that we want to, in our communities where we have thrived for decades in many cases. We shouldn't have to move out of our community in order to be safe and to where we are. So I wanted to note, one more. We have a couple more minutes of questions, so I'm going to try to get to as many. And I want to go to one from an anonymous attendee. Hello, anonymous attendee, about the folks who own nursing homes, because this is somewhat related, I think, a little bit to the religious conversation earlier as well. But this particular question is, how would hedge funds who are buying nursing homes for investment impact, what does that mean to the care and treatment of older adults, LGBTQ plus or not? And I think one of the things that I would note, and I'll certainly turn this over to Dan and Cheryl in a second, but I think there are some really interesting conversations to be had about what does that mean in terms of the residents' rights. Dan talked a little bit about that earlier, about what is required by law, what is required either in federal or state. And I think that's one of the things to remember too, is there are still protections that are in place, regardless of who the owner is. And those are things that we, if we are noticing places that are violating some of those requirements and rights of our patients and our residents, that there are places for us to go and talk about those types of things. So I'll be quiet for a second. Cheryl, I don't know if you had anything specific wanted to add on that question.
Yeah, I would agree. I think, there's CMS regulations, so Centers for Medicare and Medicaid Services. They have regulations in place that, relate back to skilled nursing communities, as well as, regulations through HUD residents' rights. There are a number of things that, regardless of who the owner is, they still have expectations on how they serve people and how they treat people. So those are all things to really keep in mind.
And to add to that, of just kind of seeing where the industry is at as well, is these organizations are also competing with one another when it comes to finding residents or clients. And so the reality is that some folks approach us, not necessarily from the goodness of their heart, first and foremost, but the reality of wanting to seek and reach out residents. And so in those conversations, we are able to then, as national organizations, guide them, but do so in a concentrated way. And we've actually been engaging with communities that haven't even broken ground yet, but know about the LEI. They want to be inclusive from the get-go and be prepared, because the reality is that we are aging and we are seeking services. And so some of these institutions are really thinking, longer term of what does it mean to be inclusive, and not just in issues related to sexual orientation and gender identity, but religion, race, ethnicity, a wide variety of identities and intersecting identities. So it is promising that folks are being motivated for different reasons, but ultimately recognize that there's a missing piece and they want to address it before they even open their doors.
That's a really good point, Dan, that you made about, that these entities are often businesses. And so, when consumers, us, ask for the things that we want to be able to participate in what they're offering, it's a pretty strong motivator, especially for those groups like the hedge funds. If they're not providing a service or that we are interested in taking advantage of, then we just won't use the service, right? And we'll find somewhere else. And I think that's one of the things to also remember is, we can what is that? We can vote with our pocketbooks. Those types of conversations as well. I want to go quickly, and we're somewhat running out of time already, which is can't believe that this is going so quickly. But one of the questions for the chat that I think was also something for that would be really interesting for us to talk about is the non-long-term care retirement communities. So whether those are 50 plus housing developments and those types of things. Are there online resources for those types of housing options as well that are LGBTQ plus friendly? Cheryl, do you want to start that one?
Yeah, I'm happy to start with that. So through SAGE, we also have the SAGE National Housing Initiative, and that program is working specifically with the senior housing providers across the country. So your 55 plus communities. And they're working to help those programs be LGBTQ plus welcoming and inclusive. And again, that's also a growing list of providers. Those communities can also participate in the long-term care quality index. So we will be also adding more and more of those communities to the work that will be listed through the LEI website and reports. And it's also important that those long-term care or the 55 plus communities should be open to all residents and really should not be discriminating. So again, the questions that we've talked about here today are questions that you can ask of those providers. And if you face discrimination, please feel free to reach out so that we can help connect you with resources.
Dan, did you want to add anything on that one too?
Just to let folks know that in terms of resources that we have with the LEI, that includes one-on-one technical assistance, webinars that go over some of these policies we spoke up about today in depth, as well as an accompanying resource guide. So individuals on the call today that are associated with aging organizations or long-term care or residential senior housing, please feel free to reach out so we can connect those folks. And we'll drop our emails in the chat towards the end. Great.
So I'm going to combine a couple of questions here, both from chat and from the Q&A, just really quickly about the feeling that sometimes it is safer for us to be in spaces that are reserved for LGBTQ. I think that's one of the things that we've seen throughout history in terms of our spaces, right? Spaces that are designed and ready for us. And so there is some concern both in like I said, in the chat and in the Q&A about particular facilities being designed for LGBTQ that, because of the nature of them, must then be open to everyone. And how does that work into what we're talking about here? Dan, I'll throw it to you first, and then we can go for Cheryl for some other comments.
So we are seeing, like you were stating, some movement in developing LGBTQ plus inclusive housing. The reality is that it's only going to serve a small percentage just because of the scope of applications and the amount of rooms that are available. And so that's where a lot of our work sits in, at ensuring that we're working with local organizations, long-term care providers, senior housing providers, to ensure that they are taking the steps in order to be inclusive. And it's also noted that while an organization or a community may be LGBTQ specific or focused, they may not have all the best practices in place. So really, where this is a continuation and growth really as an entire movement in terms of housing options. But often what we do see is folks needing that guidance and wanting that guidance, regardless of who they're serving. Cheryl?
Yeah, and I think specifically for many of these programs, they're public financed. And so whenever there's public financing involved, they can't serve just one segment of a community. They really do have to be open to all. And so when we see an LGBTQ affordable housing apartment being built, there is a focus of working closely with the LGBTQ community to make sure that we're aware, of these services and to make sure that we're applying. But what we also see is many of these communities, regardless of where they're located, there is a waiting list. And so, that's why it's so important that we continue to really expand, the communities that we're engaging and working with anyone who wants to come to the table and help support LGBTQ plus older adults.
Yeah, absolutely. Yeah, and I think that inclusion piece is really important for us to think about, like how are we also moving the needle with residents, right? If we are not in those spaces too and showing these folks, showing who we are, we're never going to see large scale cultural movement, right? We have to be out proud and who we are in every space that we can get in, that we are in, right? Which is everywhere. So recognizing that we're running somewhat short of time, and I don't want to cut off my amazing colleagues from being able to summarize their points, I do want to try to fit in one more question. I hope you don't mind, because I think it's really interesting. And this is from Diane, and it was in the Q&A. So I'm part of a strong partnership for age-friendly communities volunteer organization in Northern Colorado. And next week, they are actually going to be looking at strategic planning, which is an amazing thing to do right before a holiday. Good luck. And they're going to be including a goal for advocating for LEI in facilities in their communities. What are some of the recommendations about the best ways to approach those types of conversation, and what kind of help is out there for those conversations to be really fruitful?
Well, first, I'm really excited to hear this news. I saw someone else that has also created a list of their local LGBTQ friendly properties. But essentially, just to kind of set the scene for the long-term care quality index, currently we're in our survey season, but there will be an off season. So essentially for the next year, as we work on this report, we'll be working with both community partners and housing providers directly and helping them prepare for the next survey, helping them to update their own policies and practices. So in terms of, how can we support you, please feel free to reach out to us. We have a slide deck, also short videos to share with you to help aid you in presenting that, as well as, Cheryl and I are also open and happy to do presentations, to do outreach, to continue this conversation on a local level as well.
Cheryl, do you have other more to add on that one. I think that's great. And I will note, I also sent my email address and to Diane and to anybody else. I know we'll be providing that information, and Cheryl and Dan and I are also really good at answering emails, probably more than we probably should be sometimes. But please do send us some information, further inquiries after this webinar. We're happy to hear from you, and if we can't answer the question, we'll find the people who can. So I'm going to try to work towards a little bit of a closing up. Sorry, everyone, but please do keep putting your questions in the Q&A, and we will do our best to answer afterwards in some of the the final the wrap up. So I think, Dan, am I turning to you first for closing?
Yes, I really just appreciate everyone on the call, everyone registering. For those that are watching this later, thank you for passing it along. We at HRC Foundation, and Cheryl will speak to SAGE as well, really feel so fortunate to be doing this work, to really see active change and working with providers across the country, because what we see and hear on the ground are people that really want to do the right thing, may be nervous, may not sure which way to go, but know that you are out there and they want to serve your needs. And so I think, you know, while I still see stories of people being denied care and being turned away at the door, there are so many more than communities that then raise their hand and say, well, you're welcome. So our role really is to help encourage those folks continue to grow in that, as well as support the community to know you deserve better. And so we're here to set the standard of what better looks like.
And I would just close by saying that, you know, the work that Dan and I have been doing over the past, you know, few years with the Long-Term Care Quality Index, it leaves me hopeful. It leaves me hopeful for LGBTQ folks today and for the future aging LGBTQ folks. And so, you know, just thank you all again for attending. We will be getting, you know, follow-up emails out to you and answer these questions. And provide you with all the resources that you've been seeing today. Thank you all so much. And we just are really excited to be doing this work for and on behalf of LGBTQ+ older adults across the country. And thank you, John Paul and AARP.
Absolutely. I just want to also note, you know, one of the best parts, like I said earlier, about working for AARP is getting to work with some colleagues like Cheryl and Dan. And Brandon as well, from our partner organizations. I also want to do a quick shout out to our captionist and our two ASL interpreters. Thank you so much for being here. We are very grateful for you being here. One of the things that is a huge commitment, both I think of all three of our organizations, is to make sure that everything that we do is as inclusive as possible. And it's one of the things that we are very committed to. So I want to note SAGE's commitment to that in bringing our interpreters and our closed captioning here for this webinar. Wow, that was awesome. That was so good. I am so glad that all of you were able to join us today, and please do keep in touch with us as well as with our organizations. We will continue our fights internally and with our organizations to make sure that this continues to be a stepping stone towards better and better and more equitable care for our 50+ community. So thank you again, everyone, and have a great rest of your day.
Thank you all.